very briefly, for those of you who are not familiar with our fellowship program, it is generally a 2-year program, not always completed in 2 years, but generally 1,000 hours, and it's largely online. And all of you are going to be part of that transformation, that systems transformation that you've been hearing about for the last few days.
Luan Nguyen.
Now I want to share a more personal story with you. So just 2 years ago, I had my first miscarriage. And it was actually right after I attended this conference at this hotel. And my husband and I had a very difficult time, but we immediately started trying again to have another baby. And then just 7 months after that miscarriage, we lost our daughter, who was 14 weeks gestational age. And we were desperate for answers. We went to doctor after doctor, and they did the standard genetic karyotype testing on me. They checked me for blood clotting disorders, but mainstream medicine did not have an answer for me. And that was not okay with me. I needed to find the answer. So one day, I'm sitting down and listening to Dr. Bridget Briggs' lecture on methylation pathways in our body. And I know that was a big, complex topic for all of us to start wrapping our heads around. But that helped me because a light bulb had gone off in my head. And I thought, what does my MTHFR enzyme look like? And some of you are asking, what is MTHFR? MTHFR is a gene or an enzyme regulated by a gene in our bodies, and it regulates folic acid metabolism in the body. It does a number of other things as well, but the main thing that we sort of know it for is folic acid metabolism. And it's influenced by the things that we eat, by toxins in our environment, by stress that we experience in medical school and residency and all of the other training programs that we've done. And then it can also, you can just be born with a gene that doesn't have its full function. And so I had myself tested. I waited and waited for those results. And then there it was. I actually had a 50% loss of function mutation in my gene that controls folic acid metabolism. And I also found that I was severely lacking in the micronutrients that our body need to drive that reaction forward to make folic acid and to support a pregnancy. And so then what? Well, now I had an answer for my miscarriages, and I could really target the problem that I had been experiencing, and I could take back control. So I made this drastic shift to the foods that I was eating, and I started supplementing with active forms of folic acid. And in the end, I changed my body's biochemistry. And where I am today, well, like I said, the fellowship has transformed not just my practice, but my life. And after training in a pandemic and training in that trauma in a broken healthcare system, I made a decision, and I made a big leap of faith, and I decided to start my own practice. And so I am now the owner and founder of Beyond Medicine, MD. And back there in the corner are my 2 healthy twin girls.